At higher doses, you don't give a darn. So if you want to see the best, I have ever seen any TV show do somebody cranked up on scopolamine, there's an episode of NCIS, and I don't know, maybe you watch NCIS, maybe you don't. Anyway, where the terrorists have 3 of the guys, and they're one of the agents they're asking him all sorts of questions, and he's laughing, answering the questions. The guy hits him, he laughs, he answers. He's cranked up on scopolamine. You can't feel pain, therefore you can hit somebody, and you can't lie. That's called disinhibition. Okay? Your brain is terribly inhibited, and as a result, you're great liars. So, scopolamine, great drug. I don't know what else to tell you about that. So we have all of these nerve fibers coming in here. In the vestibular area, we have these inferior fibers, superior fibers that are going to innervate the saccule and the utricle. We're going to talk a lot more about hearing, I don't know, right now. Sure, let's talk about this right now. We might not get through all the cranial nerves today, but we have plenty to say. Yeah. So, hearing. Signals come in through the auditory meatus, vibrate, tympanic membrane. Signals come through the ear ossicles, coming through this, the oval window. So, hearing. What is hearing? What is it? Pressure?
Mechanical vibrations.
Mechanical, so what are we going to call those? No, they're not mechanical vibrations until they get here. Once they're coming in your ear as pressure waves. Is that a form of energy?
Yeah.
All right. So when you're hearing, energy keeps coming into your head. Oh my God, energy in, energy in, energy in. Sooner or later, your head's got to explode. You know, I mean, that's it. We have positive energy flow. Energy just comes in, does your head explode? Yeah. I mean, we see it in movies every now and then, but it's all BS. Because you've got this window, the round window. The round window is a pressure release. Pressure coming in, pressure going out. But how many of you have noticed on occasion you have to swallow to relieve the pressure in your middle ear? Ever notice that? What happens when you do that? Your ears pop, but why? What's going on? You are utilizing, they don't show it here. You're utilizing this tube. There's a tube that comes down here. The tube is the eustachian tube, the auditory, the pharyngeal tympanic duct. It's got a million names. The eustachian tube is the classic name. And it allows you, we're going to get back to these couple little muscles here in just a minute. It allows you to equalize the pressure on both sides of your eardrum. The popping you hear is actually the pressure release when the pressure in here is equal to the pressure out there, so that your eardrum goes back to shape. You actually, when you hear some popping, you kind of hear the bones kind of clap together. It's kind of wild. You go, airplanes, takeoff and landing, typically when your ears have a problem. Driving up a mountain, they pop. All the time, every time what you do is you swallow hard, you chew gum, you suck on a candy or something, and it allows you to equalize the pressure. Because the pressure in here, as you're going up, it's going to be greater or lesser?
As you go up.
As you go up. The pressure in here? You go from sea level up a mountain. What's the pressure out here? It's going to be the pressure in the air around you is going to be higher or lower? It's going to be lower. Therefore, the pressure coming into your ear is going to be lower. What's going to happen to this tympanic membrane? It's going to be pushed out. What happens to your hearing as your head kind of feels like it's swelling? You have trouble hearing. Okay, it becomes very foggy, very, very, very distorted. Because what's happened to the eardrum is, the eardrum is pushing out and these bones are being pulled apart a little bit. You swallow. When you swallow, you bring air from the outside into you. That air is under less pressure. You replace the air in here with less pressurized air. Therefore, then the eardrum relaxes. It's wild. So you have a little kid. Have you have any experience with little kids? None? Some of you? Okay. Little kids, ear infections. You know anything about ear infections? Maybe you have memories from childhood. I don't know. No? Yeah?
Fever?
What?
Get fever?
Fever's irrelevant.
No, it hurts.
It hurts. Therefore, what are the little kids doing?
Crying.
Screaming. They're not crying, they're screaming. Okay? You too would scream if you had an ear infection. Why do they get ear infections?
Water?
No, that's too easy. So, if you ever have a little kid, take them to the doctor. Doctor says, oh, we'll give them a round of antibiotics. You give it to them, they get better. A month later, ear infection. They're going, well, I don't want to do anything. You know they're going to grow out of this. You go, excuse me. How do you grow out of an ear infection? This tube, eustachian tube, the angle is going to change and the length is going to change. And when the angle and length changes, the kids are less likely to get bacteria from the back of their throat, the pharynx, up to their ear. But in the meantime, you have screaming little kid. Okay? Not just for 8 hours during the day, but 23 of the 24 hours. So the physician will recommend putting in ear tubes. Ear tubes are cool. Little here, put the tube in, little suture, hold everything in place. Ear drains. Have any of you ever seen an ear that drains? It's Christmas. Or the Italian flag, one of the two. When I say Christmas, red, white, and green. Red, blood. White, pus. Green, infected goo. It all comes out, but it allows airflow here. The airflow is going to cut back on the infection in there. And typically, the tubes fall out in a couple of months and everything is fine. Rarely do kids need a second set of tubes put in. You see these little muscles here? These are those little muscles that are innervated by the vestibulocochlear nerve. And it has to do with holding these bones in place and everything. So when it talks about movement, motor, these are them. What else can I tell you about this? So, pressure wave comes in here. Pressure wave is going to be involved with receptors in the utricle and the saccule. And the pressure wave is going to make its way through the cochlea. All of the receptors in the ear are hair cells. Let's look at the hair cells involved with hearing. So these are the hair cells. So the cochlear nerve, these small fibers come up, attached to the hair cells in here. The tip of the hair cell has little hairs. Those hairs are called stereocilia. Doesn't show it on here. And sitting above the hair cells, the stereocilia, is the tectoral membrane. Sound comes in, causes the tectoral membrane to vibrate, it hits the stereocilia of the hair cells, causing an action potential. Signal comes to you that says, I hear some sound. And depending on which hair cells in the cochlea are stimulated, there'll be different frequencies. You are going to, unfortunately, in your lifetime, experience some hearing loss. And hearing loss, some of it is normal, some of it is not. I grew up in a neighborhood where it was the common joke. In the older couples, the guys could never hear their wives. You know, and the wives were always yelling, and the old guys weren't hearing anything. What was going on? Why was that happening? Why were the old guys losing those upper... It wasn't selective hearing, as has been said. But they were actually losing the upper frequencies. You're going to be treating a whole cohort of patients in your lives that have hearing issues. They'll have lost their upper frequencies due to sound damage. The cohort that you're going to have trouble with are military. Why are they losing their upper frequencies? Sound of guns. How about police? Sound of gun. No, sound of guns. It's guns. Yeah. Led Zeppelin doesn't do it. I can attest. Yeah. How many of you have ever gotten on an elevator in the building here with somebody who stepped on, hooked up to their iPod, earbuds in, and you could hear their music? You ever had that happen? Guns, iPod, buds, earbuds are killing hair cells. Once you damage a hair cell, so you kill it, your outcome is going to be absolute. How many of you ever pulled up to a stop sign or a red light and the car next to you pulls up and you're boom, 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 you're bouncing to their music? What are you actually hearing and feeling? Which part of their music? The bass. Why? Because they have a bass booster. I know you guys probably don't know what bass boosters are. You put bass boosters in your car so that you can hear the bass end of music much better. Under normal circumstances, you hear the treble end, not the bass. The bass is supposed to be in the background. Why do you want to hear the bass better? Because it stimulates your limbic system. It makes the music really feel good. Darn, we're back to the limbic system. Yeah. Those people are also killing hair cells. Hair cells. So, yeah. 50, 60 years ago, it was the old guys working in factories, chronic, loud, continuous noises that were killing the hair cells, so that by the time they got old, they couldn't hear their wives. How did we take care of that problem? Yeah, you are so humanistic. No, we let women work in factories. So everybody went deaf. And then we brought in head protection. So yeah, hearing protection. Nowadays, you go to a firing range. You look at anybody in the military or in the police forces, when they're on the range, they're wearing ear protection. How many people in the military are wearing ear protection during a firefight? Probably very close to zero. They may not even be wearing a helmet anymore. All right? So you are going to have a whole cohort of people that have a lot of hearing issues, a lot of hearing problems. So, yes?
If you damage the membrane, will
the membrane?
Yeah.
I don't know about, if you damage the membrane, you've done damage that's not involved with hearing. You've done traumatic damage. I mean, you've piercing damage. The damage is sound coming through so heavily here that the tectoral membrane is smacking the hair cells, or the sound is actually penetrating the bone and doing damage. you can take a hearing